Hello and welcome to the Disability Diva channel. I'm the Disability Diva, and today's video I'm going to try and tackle the Disability Support Pension Impairment Table number 1. So let's diva dive right into it, shall we? Impairment Table number 1. It's used to assess the cardiorespiratory impairment resulting from conditions affecting the heart and lungs. So the impairment is measured by reference to exercise intolerance. Sorry, excuse my cat. Basically, it's the level of intolerance that's assessed by the amount of activity that causes the restriction. So basically, if it takes you 2 minutes of walking before you become out of breath, then that's your level of tolerance before a resulting symptom. And it's used to assess both cardiac and or respiratory conditions. That assessment is assigned an impairment rating based on when the symptoms occur in your activity level. However, the good thing to remember with Centrelink is that it's not assumed that if no symptoms are shown for within a reasonable amount of time, for example 10 minutes, that the person is then capable of working on a full-time basis, because sometimes that's not the case. There is an overall assessment of the impairment that's caused by any cardiac or respiratory conditions that you may have, and they may still be sufficient enough to prevent you from being able to work a full day or on a long-term basis. This is when your medical evidence becomes very important. So the symptoms that you have need to be consistently reported in severity with your medical history, any investigations and results that you've obtained, and any clinical findings from specialists or anyone else. They all need to be documented, they need to be relevant, and they need to be within 2 years of age. The specialist testing for this particular table, they tend to rely on the stress tests with ECGs. Now that can be done in 2 ways. It can be done on a treadmill where they elevate your heart rate and try and induce symptom, or it can be done with medication. So it's drug induced, basically, where they elevate your heart rate to a certain level, which is a safer way of doing it for people that do have serious cardiac conditions. The other thing that they rely on is a respiratory function test, which can be done quite easily. It's just a simple referral from your GP, and the findings from that, along with the exercise stress test, are 2 of the key medical evidence criteria used in this table. The most common conditions that this table assesses are coronary artery disease, cardiac disease such as chronic heart failure, cardiomyopathy, and heart valve conditions, whether you've got aortic valve stenosis, where the valves become a little bit tougher and hardened and don't function properly. They also use cardiac or heart arrhythmias, which means irregular heart rhythms, such as atrial fibrillation, ventricular tachycardia. There is a multitude of different arrhythmias where the heart is not beating properly that causes symptoms, including shortness of breath, chest pain, and numerous other things. And if you don't have a diagnosis and are experiencing any of these symptoms, please go and see your doctor or your medical professional straight away. They also cover chronic obstructive airways disease, and they include restrictive lung disorders like chronic asthma as well. So remember, you need to get at least 20 points or more in one impairment table. So 40 points on this impairment table means that you are symptomatic at rest or with minimal activity, doing things like just lying down or sitting down and talking on the phone, travelling as a passenger in a car, walking slowly, standing up in one spot, typing, sitting, knitting, etc. 30 points on the impairment table means that you're symptomatic with mild activity, with things such as getting dressed, showering, performing light household duties like washing the dishes, walking slowly and for short distances, playing the piano, driving a car, making your bed, and cooking and preparing meals. And the minimum amount of points that you need to obtain on this table to reach your 20 points means that you need to be symptomatic with moderate activity levels, such as walking slowly, vacuuming, shifting chairs, light gardening, hanging out your washing, playing golf, tidying your house, and lifting and carrying heavy objects. So if you're able to provide the evidence to at least be symptomatic with this moderate activity level, then you have reached your 20 points and you qualify for the disability support pension. So next time I'll tackle table number 2. So until then, Diva out.
It's the Disability Diva. She don't like Centrelink neither.